We're in a world driven by information, where access to knowledge is at our fingertips. But with this power comes great responsibility. Today, the digital space, especially social media, has become a thriving ground for misinformation and fake news. A 2019 study done by Ipsos actually shows that 86% of online global citizens have been exposed to fake news. Studies also shows that misinformation spreads faster online, and individuals who encounter this on social media are more likely to actively share it further. For example, it is 70% more likely for fake news or misinformation to be retweeted on Twitter more than truthful news. Now, as we're aware, online health misinformation remains a threat to public health. There is a proliferation of health misinformation online, with topics ranging from vaccines to mental health, amongst others. Now, did you know that according to the National Institute of Health 2020, 72% of Americans rely on electronic sources for information about health and medical related topics? This goes to show that a large percentage of the population is susceptible to health misinformation online or to encountering health misinformation online. It is also eye-opening to know that a study conducted by a group of researchers in 2021 shows that 13.05% of breast cancer topics with at least 1,000 shares on social media are classified as misinformation. Although we encounter misinformation online, this doesn't necessarily guarantee our belief in it. But studies also show that repeated exposure to misinformation increases the perceived accuracy of it. At Verity Times, we're committed to addressing health misinformation and promoting health equity and access, recognizing that every individual, regardless of their circumstances or background, deserves the opportunity to access reliable and accurate health information. We conduct research on misinformation and health misinformation topics and empower you with the right skills and knowledge to debunk misinformation when you encounter them online or offline.